Good afternoon, everyone. We're going to wait one more minute for everyone to join us, and then we will get started. Good afternoon, everyone. We will go ahead and get started. Thank you for spending your lunch hour with us to discuss tobacco cessation changes in patient resources in Minnesota. My name is Ellie Parker. I'm the Physician Advocacy Network Project Coordinator at Twin Cities Medical Society. The Physicians Advocacy Network is a statewide initiative of Twin Cities Medical Society to educate healthcare communities about emerging trends and changes in the tobacco landscape, engaging physicians and other healthcare providers in local level tobacco policy decisions, and empowering providers to become leaders in reducing tobacco use in Minnesota. We are pleased to be hosting today's event with Clearway, Minnesota. And before I introduce the speakers, I want to quickly just cover some housekeeping items. First of all participants are currently muted, and you will remain muted for the duration of the webinar. We have allocated time at the conclusion of this program to field questions. So if you do have a question that you would like answered, please use the chat box function, and then at the end we will read aloud the questions and answer them. The webinar is being recorded and it will be made available on our website at www.panmn.org, and then the PowerPoint slides will also be available afterwards. Finally, if you would like to claim continuing medical education for attending today's webinar, you must complete the evaluation that will be sent via email at the conclusion of the event. So the survey completion is mandatory in order to receive CME, but we do encourage all participants to complete the survey even if you would not like the CME. Now to introduce today's speakers. Amanda Jansen is Senior Cessation Manager at Clearway, Minnesota, an independent nonprofit organization that improves the health of all Minnesotans by reducing tobacco use and exposure to secondhand smoke through research, action, and collaboration. Ms. Jansen leads Clearway, Minnesota cessation policy initiatives focused on ensuring access to comprehensive tobacco dependence treatment for all Minnesotans. She spearheads policy efforts to improve health insurance benefits for tobacco cessation and to strengthen tobacco-related health care quality measures. Ms. Jansen has extensive expertise in state-level implementation of healthcare reform initiatives, including the Affordable Care Act. Prior to joining Clearway, Minnesota in 2010, Ms. Jansen was a public health research and policy consultant focusing on policy, systems, and environmental changes at the community level. Ms. Jansen earned her bachelor's degree in psychology from the University of Wisconsin-La Crosse and her master's degree in public policy from the Humphrey School of Public Affairs at the University of Minnesota. Randy Lachter is also a senior cessation manager at Clearway, Minnesota, and has been involved in tobacco cessation and policy work for more than 14 years through Clearway, Minnesota and the North American QUITPLAN Consortium. Prior to working on tobacco, Ms. Lachter worked on a research project to reduce underage alcohol use in northern Minnesota communities and in product development for the treatment field and healthcare. Ms. Lachter currently oversees QuitPlaN Services, Minnesota's statewide cessation program designed to help all Minnesotans quit tobacco in a way that fits their needs. Ms. Lachter graduated from the University of Minnesota School of Public Health. Brianna Langeway is the tobacco treatment coordinator for the Minnesota Department of Health, and at the Minnesota Department of Health, Ms. Langeway administers the Quits Referral Program, a tool used to more easily refer Minnesotans to QuitLine support for tobacco cessation counseling. Ms. Langeway is also responsible for many of their other cessation-related activities, including management of the Medical Assistance Outreach Campaign, which was designed to better inform enrollees of their tobacco cessation benefits. Amanda, you can take it away.
Thanks. So my name is Amanda Jansen, and I'll be starting us off for the presentation today. Today we'll start with a quick reminder of why treatment is important and what best practice tobacco dependence treatment looked like. I'll also share some data from the Minnesota Adult Tobacco Survey. We'll then focus the rest of the presentation on providing you information about tools and resources available to help your patients quit. This includes some significant policy changes that help increase access to insurance coverage for treatment, as well as QuitPlan Services and the Call It Quits Referral Program. We'll then have some time for question and answer. So first on treatment, we know that tobacco use is a chronic relapsing condition and that it takes people multiple attempts before they quit for good. We also know that there are evidence-based ways to help your patients quit using tobacco. So we know that counseling works, medication works, and the combination works. We also know that advice from healthcare providers increases the use of evidence-based cessation treatments and improves outcomes. So in Minnesota, Clearway, Minnesota, and the Department of Health partnered to do the Minnesota Adult Tobacco Survey. During that survey, we asked smokers in Minnesota about their experience at the doctor's office. So in 2014, this is what they told us. Almost all of them were asked if they smoked. Just over 3/4 were advised not to smoke. And just over half received a referral for assistance, which could be a referral to a quit line, provision of counseling services, or a prescription for medications. We also heard that only 1/3 of them used some form of assistance in their quit attempt. So given all this, there are opportunities for us all to work together to get more smokers the help they need to quit. That is, to increase that 52.6% and that 30%. The fact sheet that I have linked here talks about this data in more detail and outlines some of the steps we can take to improve rates of treatment delivery. I've also included a link here to the Minnesota Adult Tobacco Survey website that gives you just more information generally about tobacco use in Minnesota. So next I'll go into a little bit what the Affordable Care Act says about tobacco cessation and implementation efforts in Minnesota. So at Clearway, Minnesota, our goal is to have a comprehensive tobacco cessation benefit included in all public and private insurance products sold in Minnesota. This would mean barrier-free coverage for all forms of cessation counseling, that's individual, group, and phone counseling, and all FDA-approved medications. The Affordable Care Act is a tool for us in this work. So the Affordable Care Act says that all preventive services graded A or B by the United States Preventive Services Task Force must be covered in most insurance products without any cost to the patient. I say most insurance products because some products are still grandfathered in and don't yet have to comply with this component of the ACA. So the tobacco cessation was rated A. It was initially very unclear how this rating was to be translated into insurance coverage. The rating wasn't specific enough, so health plans, providers, employers, and other stakeholders didn't know what was required for insurance coverage. The rating has since been clarified and updated, which leads me to my next slide. The most recent update was this past fall of 2015. So in this update, the USPSTF updated the cessation interventions rating and clarified that they include all types of counseling, so again, individual, group, and phone, and all FDA-approved medications. Most health insurance products that begin after October 1st of 2016 must comply with this updated rating. So here I've included a link to a Lung Association fact sheet that summarizes more this rating update and kind of what it means for insurance coverage in general. So the preventive services requirement also applies to a portion of the Medicaid population. We leverage this in Minnesota to remove copays on cessation medications for all Medicaid and Minnesota Care enrollees. So as of January 1st, 2016, all enrollees have free coverage for individual and group counseling and free coverage for all 7 FDA-approved cessation medications, including nicotine replacement therapy and prescription medications like Chantix. Enrollees also have access to phone counseling either through their health plan or through QuitPlaN Services. So we've also done some work to close coverage gaps in other insurance products regulated by the state of Minnesota. Generally, here's a snapshot of the coverage landscape today. So I already went over medical assistance and Minnesota Care. State employees of Minnesota also have a comprehensive benefit. Most commercial insurance that's regulated by the state has comprehensive benefits. Where we see the most variation is still in the self-insured market. So it's important to note that about 40% of Minnesotans are insured through a self-funded health insurance product. So because of this, there may still be a lot of coverage variation among these individuals. And with that, I'll turn it over to Randy to talk about QuitPlan Services.
Great. Thanks, Amanda. I'm really glad to be here today to tell you a little bit more about QuitPlan Services. Of course, I do want to offer that if I have to go quickly over some of the details, but if people have follow-up questions that we don't get to, feel free to email me. I think our email addresses are at the end. But in general, I just wanted to, in case people aren't familiar, QuitPlan Services is the statewide cessation program available to all Minnesotans. We run an advertising campaign that you might have seen either or heard on the radio. And important to note that QuitPlan Services is not the only cessation available to Minnesotans, and we'll talk in a little bit about health plan coverage and that health plans are also offering telephone counseling and other cessation support. But it's important for we feel it's important for everybody to understand what QuitPlan Services offers, because we do provide, and I'll explain this in a moment, some of our services to all Minnesotans, no matter what insurance they have, and we are a source for connecting tobacco users to the proper QuitLine services, the proper telephone counseling services based on their insurance coverage. So with that, I'll move on to the next slide, and Amanda is advancing my slides for me. Thank you very much. So this is the QuitPlancom website. I encourage anybody who hasn't had time to just check this out. It's a great place for tobacco users to start, or anybody to start who wants to learn a little bit more about quitting, no matter what stage they're at. The content is quite robust. It includes 3 sections that you can see, hopefully, across the top. There's a section for those who are just thinking about quitting. There's a section for how to quit, and then for those who are ready for services, there's a section that talks in more detail about all the services, which I'm going to tell you about today. Within each section, there's articles, information, interactive tools based on what we know helps tobacco users move through the quitting process, and we know that it is a process and can take many attempts for people to be successful. I do want to point out in the upper right-hand corner, we recently added the Google Translate option. So we were hearing that people wanted to possibly be able to review the content in other languages. So we know that Google Translate is not perfect, but we do have this as an option. So on the next slide, I wanted to point out that the entire site has also been translated into Spanish for those who prefer to receive the information in Spanish. So we will move on to the individual QuitPlan services. And we do offer 2 programs you'll see on this slide. We offer, circled in red, individual QuitPlan services, which I will talk about first. And then we also offer the QuitPlan Helpline, the telephone counseling program, which I will talk about after the individual services. It's really important for everybody to know that tobacco users can pick and choose what works best for them. We launched these new services a little bit over 2 years ago because tobacco users were saying, I want to quit in my own way. Some people said, I want a lot of help. Some people said, I don't want any help, but okay, if you want to give me NRT, then I'll take NRT. So first I'm going to talk a little bit more about individual QuitPlan services. The next slide gives you an overview of what's available to all adults who live in Minnesota. So again, we don't ask insurance. People don't have to tell us what their insurance is in order to enroll in individual services. And the 4 options are a starter kit with 2 weeks of free NRT. And I'll talk in more detail about each of the components in a moment. We also offer a text messaging program. We offer an email program. And we offer a printed quit guide that people actually can have mailed to them, or they can download from our website. Again, people can choose any or all of the services. I do want to point out that youth can sign up for our email program if they're at least 13, or the quit guide, but we do not provide NRT to anybody under age 18, and we don't offer texting either for those who are under 18. So let me talk in more detail about the starter kit. This is our most popular service. About 90-some% of people who sign up for individual QuitPlan services choose a starter kit, And then they also choose other things to go with it. Sometimes they just want the starter kit, but they also might choose email or the quick guide or all 4 options. This is, again, 2 weeks of patches, gum, or lozenges. People do need to pick one of those, and we do have questions and algorithms that help them pick the right one. They do agree to a follow-up call from a Quit coach. This occurs about 15 days following enrollment. And the purpose of this call is to confirm that they received the NRT starter kit, answer any questions, and if it makes sense during the conversation, the coach will offer additional services. Might say to the person, oh, it sounds like, you might benefit from getting some text messages. But again, only if it makes sense, and we're not trying to push really hard on people to sign up for more services. People also do receive medication support emails if they sign up for a starter kit. And the medical screening is based on the FDA labeling that's on any package of patches, gum, or lozenges that you would buy in the store. So those are the few questions that people go through. If people do not pass the medical screen, there is a process for getting an override from a healthcare provider. And I can talk about that a little bit more when we get into the Helpline discussion. And the limits for Minnesotans are 2 starter kits per year, and they do need to be at least 3 months apart. So let's move on to the text messaging program. The content here really is to provide encouragement, motivation, some reminders, tools to help people fight the urges that we know they're likely to experience when they're trying to quit. There are up to 300 messages depending on how engaged the person is. People can, sometimes they'll ask you a question and you can respond yes or no, and then they might send you additional messages based on your response. Sometimes people do engage in that way. Sometimes they're just receiving the messages and they're not doing any of the back and forth. People are required to set a quit date in this program, but they can change their quit date. There's tips, games, reminders, again, encouragement, and the limit here is 1 time per year. People can sign up for the text messaging program, but you'll see that, if it's 300 plus messages, that really can last almost a whole year if people want to continue to receive those messages. The program is free, but depending on what type of text messaging plan someone has, it's important to point out that they could still be charged for the incoming text. So moving on to the email program, this is pretty self-explanatory. It's just another way to deliver information and motivational emails to support participants with their quit attempts, or also works for people who are just thinking about making an attempt. The email program is available in Spanish as well. It's about 13 emails over 24 days. And again, the enrollment is limited to once per every 12-month period. So lastly, the quit guide. This tobacco users told us they wanted something tangible that they could refer to time and time again. And so we started making this quit guide available. It used to only be available to those who registered in our more intensive program. But now we mail out many of these, hundreds of these a month. They're very popular. 2+ years in, they continue to be extremely popular. So we're really glad that we're hopefully filling a need for tobacco users. Again, people can also download a PDF from our website at any point that they want. Again, it's designed quite similar to how our website is, where it can help people at any stage of change, stage of readiness. And we do limit 1 printed guide mailed to people per 12-month period. We do have supplementary material available for the groups listed here on the slide: pregnant, postpartum, Hispanic, Latino, smokeless tobaccos, Native American, LGBTQ, and that's only mailed, though. Those are not available for download from the website. So let's move on now to talk about our more intensive service, which is the QuitPlan Helpline. And this has been around since 2001. It used to be called Minnesota's Tobacco Helpline, for anybody who might be familiar with that. Now I'll go more in depth about what we offer there. So this is, again, as I pointed out earlier, this is referred to as telephone counseling or telephone coaching. QuitLines provide easy access for people looking for a more intensive program, provides flexibility and a high level of individualization. We know that people then don't have to make an appointment to drive, show up. They can do it 24 hours a day, 7 days a week, because those are our hours, and really set the appointment based on their schedule. It also allows us to serve many, many more people through this model. All 50 states have telephone counseling quit lines, as do all the provinces. So it's really taken off, and over the past 20 years has become a pretty standard service to offer to tobacco users. Our program includes 5 coaching calls and 4 weeks of patches, gum, or lozenges. Plus, we are now offering combination therapy, and I'll go into the NRT details in a few more slides because that's of high interest to people. We offer an integrated text program, and all we mean by integrated is it provides the same motivation and support to tobacco users. It's just that if you're in the coaching program, you'll also receive reminders about your upcoming coaching calls and a little bit more kind of linked support to go along with your coaching sessions. Same with the integrated email. We offer a welcome kit, which includes the Quit Guide plus any relevant supplementary materials, and we do allow people to enroll 2 times every year or every 12-month period in the QuitPlan Helpline. A little bit more about the QuitPlan Helpline. You heard me refer to insurance and the health plan quit lines earlier. So we do ask insurance status for those who are interested in telephone counseling. The QuitPlan Helpline serves the uninsured and the underinsured, including the Medicaid fee-for-service. So underinsured for us means if you don't have access to telephone counseling or NRT through your health plan, then we consider you underinsured, and we will provide, you can enroll in the QuitPlan Helpline. If in the process of assessing insurance, we find out that you have insurance through one of the health plans that offers their own QuitLine services, we provide a transfer, a warm transfer to that QuitLine service. And this is an agreement and arrangement that we've had with the health plans since 2001. It's been working since 2001, and people understand that we serve the uninsured and underinsured, and we transfer the others as needed. So more about the QuitPlan Helpline. Again, we're available 24 hours a day, 7 days a week. We do, people do need to live in Minnesota in order to be eligible for the helpline, but the great thing is every state has their own telephone counseling services. So if you do work with patients in Wisconsin or Iowa, they can just call 1-800-QUIT-NOW and be connected with their state's quit line. We do offer some in-language service just through the QuitPlan Helpline. We offer in English and Spanish. And then for those who speak Cantonese, Mandarin, Korean, and Vietnamese, we do transfer them to a national quit line, which is called the Asian Smokers Quit Line. It's run out of California, UC San Diego. They've been offering that service for more than 20 years. And then all other languages will receive services through an interpreter. It does take about 3 minutes to get an interpreter on the line, so if you're working with anybody who needs an interpreter, it's maybe helpful to let them know that. So a little bit more about how to access an interpreter in the quickest way possible. This information that's on this slide is on our site at QuitPlan.com, and we have in the upper right-hand corner next to where the Google Translate is, we have a link for other languages. And we have in all these languages listed here, it looks like there's 7 of them, this statement. So we want to let people know if you need support, you can call us and ask for a coach using an interpreter in your language. And so if you have anybody who speaks any of these languages, you can point them to that page, or certainly if you're using an interpreter in the clinic, you can let them know, nope, call QuitPlan and ask right away for an interpreter, and it'll ease the process. So let me talk a little bit more about NRT because people are very interested in that. Again, it's a 4-week supply for those who are signing up for the telephone counseling. We know that they're working with coaches more closely, and so we have always provided more NRT to those who are at this level of receiving support. It's patches, gum, or lozenges, And then starting just July 1st, we started offering combination therapy. So anybody who receives patches through the helpline, and if it makes sense, the coach and the tobacco user decide this makes sense, they can also get 2 weeks of gum or lozenge. This combination therapy approach has a lot of research supporting it, and we know that the patch is delivers a long-acting form of NRT, and the gum and the lozenge deliver a short-acting form, and so in combination, they really can help tobacco users. So we're very excited to be offering this. Many other states are offering this as well, and quit rates have been shown to improve with use of combination therapy. So we're looking forward to watching the interest and seeing what happens there. Again, of course, we do the same medical screening for the helpline NRT, and we do offer to those age 18 and older. And just a reminder, 2 enrollments every 12 months for the helpline, so that means you can get the 4 weeks of NRT through the helpline twice every 12 months. If somebody does not pass the medical screen, I did say I would mention this, what happens is they receive a letter in the mail from QuitPlan Services with instructions about how they can receive health care provider approval. So it includes a form and instructions where the caller or the tobacco user would bring the form to the clinic, and then the clinic would fax the form or send in, if they choose, send it back to QuitPlan Services, and then we can provide NRT. This includes pregnant women as well. We do require an override. So real quickly, in the interest of time, I mentioned that the QuitPlan helpline coaches can really personalize the process for each tobacco user. And the way they do that is they really talk with the tobacco users about their previous quit attempts. What worked for you last time? What didn't work last time? What barriers do you see? Do you live with other smokers? Really finding out the person's background and what's motivating them to quit, and maybe what they believe is standing in their way. And so no matter who the tobacco user is, all of these things come into play when the coaches are helping develop a plan. The coaches help people gain, the knowledge about tobacco, about quitting tobacco, behavioral strategies, and the cognitive skills that have been shown to help people quit. And of course, the coaches help dose the NRT as well to figure out what the best combination is and the best dosage. So what people do ask us what to expect in the first call. So we confirm contact information. Obviously, we need to make sure we're talking to the right people. We gather tobacco use history, past quit attempts, and we, through a discussion, discern readiness to quit. Obviously, the coaches will describe the program, what people can expect. They pause a lot to ask people if they have questions. And then some of the logistics, obviously, want to make sure that the tobacco users know how they can access the helpline, because people, even though it's a 5-call program where coaches will be calling to the tobacco user, tobacco users can call in at any point if they feel like they need additional help. The first intake call takes about 12 minutes, and then the coaching calls take anywhere from, I would say, about 15 minutes average. So the last 2 slides are how to enroll in QuitPlan Services. So people can enroll by phone or by web. And on QuitPlan.com, there are many of these green sign-up buttons throughout the site, so people can just click on the sign-up button when they're ready and go through the web enrollment process, or they can enroll by phone using any of these 3 phone numbers listed here. And the process and the questions that we ask are identical for both web and phone. And lastly, I know people do often ask about our quit rates. We're happy with, real quickly, we did assess quit rates of enrollees from May to July of 2014. This is the last outcome study that we did conduct. And overall, this is combining the helpline and individual services. We're at a 26.1% quit rate. And if you look at helpline separated out, it's a little bit higher. and then individual services is at about 25.5. And just to note that most of those 858 people in individual services would have received a starter kit. So the NRT, is powerful. And that difference between the helpline and the individual services quit rate is not statistically significant. So we we're very happy with these quit rates. We will be doing another outcome study next fiscal year. And now I will pass it on to Brianna.
Thank you, Randy. I really appreciate it. So my name is Brianna Lonjoy. I'm the Tobacco Treatment Coordinator with the Minnesota Department of Health. My primary role there is to administer and run the Call It Quits Referral Program, as we had previously talked about briefly. And I'll go into that a little bit more today. But I just wanted to start kind of framing it up right now. Looking at our overall tobacco or smoking rate in Minnesota. So while we have made significant strides in tobacco prevention with the average statewide tobacco use rates at a historic low, many communities still struggle with high tobacco use rates. As you can see, there are still many communities here that are desperately impacted by tobacco and thus have much higher smoking rates. So there's still much more that we can do, and there's groups that we need to particularly increase efforts in targeting and getting them the help that they need. So as it turns out, most smokers in Minnesota want to quit. So according to the 2014 MATS survey, the Minnesota Adult Tobacco Survey, 53.4% of current adult smokers have stopped smoking for 1 day or longer in an attempt to quit. That's great, and we're very excited to see those high numbers, but as we had talked about, as Amanda had mentioned, it is a relapsing chronic condition, and many might have relapsed from that one quit attempt and aren't quite there yet. There might be many that aren't motivated or ready to take the first step until it's recommended by their healthcare provider or a trusted individual. So as we've found out, and as you can see here, we kind of have a trifecta of what we see as most effective in being successful with quitting. That includes provider involvement. So providers, you all play a key role in both motivating the patient to quit and connecting those patients to effective cessation resources. It includes cessation counseling. So as we've talked about, that includes telephone counseling or in-person counseling, which is an evidence-based practice to support the quit attempt. So the Call It Quits Referral Program is a way to more easily connect individuals to telephone-based counseling from a certified tobacco treatment coach. In addition, it includes medications. So in order to be the most successful that research has told us, cessation medication includes NRT, as we talked about, gum, patches, and lozenges, as well as prescription medication, Chantix and Wellbutrin. When they're used correctly, these can be very effective in supporting a quit attempt. Now, as I had said, research shows that with counseling and medication combined, that dual therapy, that individuals have a much higher success rate for their quit attempt. Cessation coaches can help by advising on medication usage in conjunction with the counseling sessions. So the other thing that we know here in Minnesota, everyone has access to cessation support. So as Randy had mentioned, we do have health plan quit lines that provide cessation for their members, and we have QuitPlan Services. So everyone in Minnesota has access to free quit line support. Minnesota's quit line system, as I had said, includes those health plan operated quit lines as well as QuitPlan Services, which you had just heard about. And although this is covering everyone in the state, we also know that this can be a barrier sometimes, knowing where to direct individuals to, especially in the healthcare field, when they're very interested in quitting, and we just need to figure out where exactly they need to be going to and what's appropriate for them. And that's where the Call It Quits Referral Program can help. So as I had mentioned, MDH operates the Call It Quits Referral Program. The program is a way to streamline the referral process for healthcare providers to connect smokers to quit lines, and it's another way to easily offer cessation resources to smokers that need help with quitting. We currently have over 1,200 clinics enrolled. The program has been around since 2008. So we have a long history, but we know that of those clinics that are enrolled, there are many that are not actively referring. We've had turnover, some have closed, so there's much more that we can do to help support this work and making those referrals. Currently, we are utilizing our extensive grantee networks to reach out to and work with health clinics and systems to better integrate the referral program into the work that's happening at the clinic or health system level. In addition, as a side note, we have recently expanded the referral program to allow non-HIPAA compliant organizations, so organizations outside of the healthcare setting, to begin making referrals to the QuitLine via the Call It Quits referral program. We have done this to allow a greater reach into the community and getting into those specific communities and populations with very high rates, as I had shown a few slides ago, and more easily connect those individuals to cessation support. So getting into how the referral program works. So upon enrollment and registration, which is free for the clinic, we just need to have you fill out a little bit of information on our Call It Quits MDH webpage. It just kind of, we can walk through the process here rather than having to know which individual qualifies for which health plan or for which QuitPlan, QuitLine health plan, excuse me, or the number that they need to call. They can simply be referred to one central fax number through this program. So in the beginning box there to the far left, we would, the healthcare provider, you all would assess the patient's tobacco status. As Amanda had mentioned, this is already happening. We're doing very well in the state, and their interest in quitting. After that step, you would complete the referral form with the patient and fax that referral form to the central triage number that's located on the upper right-hand corner of the referral form. And then that burden is kind of taken off you then. On the back end, the central triage organization that we contract with identifies the appropriate quit line for the patient and gets that referral to that quit line. And the quit line contacts the patient. So they proactively reach out to the patient and give them a call based on what is filled out on the referral form for what is the best time to be reached for the individual and all of the information that they need the appropriate phone number to be reached at and everything else that for their contact information. And then finally, for healthcare sites, patient outreach results or the outcome data is returned back to the clinic within a few weeks. So included in that outcome data is when the patient was contacted, whether or not they were reached, and whether or not they ultimately had enrolled in the QuitPlan Services. So as I had briefly mentioned, the Call It Quits referral program is a proactive approach in connecting with the individual. So rather than waiting for the individual to contact the QuitPlan and having them leave the clinic or hospital with a telephone number to call, the cessation coach will reach out to the referred individual via the Call It Quits referral program. Evidence shows that it is much more effective than reactively waiting for the patient to get the help that they need. And so the goal of this, as I had mentioned, free program is to help healthcare providers, you all, more easily connect individuals to QuitPlan support. So this is a proactive tool that was designed in collaboration, QuitPlan Services with the health plans came together, and we want to be able to reach out to smokers to provide telephone-based cessation counseling. And our goal at MDH, and as the administrator of the program, our goal is to increase quit attempts among tobacco users in Minnesota. So we want to do this by increasing provider enrollment. So we want you all involved in the program. We want you making referrals. We want you helping patients the best that you can and providing the resources and services for them. And we want them ultimately to enroll in services. So we want to increase those patient referrals and enrollments in the QuitPlan Services. So we want to help build capacity among the enrolled providers through training such as this and other resources that we have available. We are expanding the program, so we have a number of resources on our website, which will be on the next slide, in English, and we have just recently translated the materials into Spanish and the referral form into Spanish. we're hopeful that we can build upon that and perhaps translate them into other languages. So more to come on that. So finally, just kind of the last slide I wanted to include here is our website at the top, and then how to get started. So how to register. As I had said, the clinic and health system needs to be registered with the Call It Quits Referral Program, but it's free and it's a pretty painless process. And then once it's confirmed, you can start referring patients immediately. So upon enrollment, the clinical information is included and uploaded to the referral form, which is then sent to you via email. And as soon as you get that, you can start referring patients immediately. Upon that enrollment and confirmation, additional resources will also be mailed in a welcome kit. And as I had said, they are available online as well if you need something sooner. Part of the referral program is being able to monitor the referrals. So we have a data portal that you will have access to for your clinic to monitor the referrals that you've made. And then there's quarterly updates with additional tips and tools that we will send out, and they can provide a lot more information on webinars or trainings or just other news resources. So with that, I want to thank everybody, and I think we'll just go into questions then.
So just as a reminder, if you have questions, you can type them into the chat function on the webinar. The first question that we do have, Randy, this one is for you. When someone calls the QuitPlan helpline, can QuitPlan check if they have insurance coverage for phone counseling and or NRT?
That's a great question. We do not have access to the health plan databases, and so as you know, health insurance is quite complicated, and there's many products. We do have each year and as needed, get from the health plans the information in general about their coverage, and so we do our best, but we do also have to let people know that the most reliable way to know what your coverage is to check with your health plan. I wish we had access. We had dreams of having access to all that information, but we do not.
Thanks, Randy. The second question that we have is for Brianna. Should we, providers, use the Call It Quits program to refer patients to QuitPlan Services rather than sending them directly to QuitPlan Services?
So that's a great question. I wouldn't say that you need to necessarily use one or the other. I think there's two different ways that you could possibly do that. So in connecting patients to QuitPlan Services, you can absolutely provide them. They have materials and a brochure with the number to call, and if that is what seems like the best option, then you can absolutely do that. The referral program is a way then to just have them in the room at the time that they say they're ready to quit, to fill in the information and send it in, and as I had said, then it's that proactive step. So rather than sending them out the door with the number to call, they would receive a call within 1 to 2 days for describing the services, and it would be from the appropriate quit line. So as Randy had said, QuitPlan Services does warm transfer based on insurance status. But again, this is just a different way to go about getting the patients connected to the quit line.
Well, the other thing too, this is Randy, is that if you and our brochures are available on QuitPlancom. If you go to the bottom, you'll see an order materials link, so you can order materials that way. But if the clinic in general wants the feedback loop from each of the quit lines on whether or not the participants enrolled and what services they enrolled in and if they got NRT, then the referral program is the way to go. If you just if people are just calling on their own, you miss that feedback loop.
So the next question we have is, I've been seeing more prior authorizations for Chantix and the nicotine inhaler, as well as denials for these two medications. Are there additional services available for individuals who want to use these as options but have been denied by their insurance? It's a really good question. So a few things here. One, the QuitPlan only offers patch, gum, or lozenge. So as far as other options for coverage for specifically Chantix and the inhaler, that wouldn't be something that QuitPlan would offer. But I would say, going back to the Affordable Care Act, there should be, most health plans in the state should cover all forms of medication, so all of those FDA-approved medications. There will be some prior authorizations, and I think the two that are outlined here, Chantix and the inhaler, are two of the most common ones, but it should just be one extra step, what we would call a barrier, and we're working to get rid of those. But it should just be one extra step, but there should be ultimately coverage for those things rather than denial of coverage. So in that case, I would encourage the patient to call their health plan, especially those with insurance, to call their health plan and, you know, kind of push back a little bit and reference that this is a preventive service that should be covered under the Affordable Care Act. And then the other question that we have is, I think for Brianna. So I'm a certified tobacco treatment specialist who works out of a community-based organization, not a clinic. Could I register to refer people to Call It Quits, or is it clinics only?
That's a great question. It is not clinics only. I had mentioned just briefly that we have expanded the program, so that has just happened. But we are very excited about that. So you can absolutely contact me, and we can work on a way to get you able to start referring patients. So it is available to community-based organizations outside of the healthcare field. The only slight difference with that would be that patient outcome. The feedback would not be included just because of the HIPAA compliance. But you can absolutely connect with me, and we can have you start referring the individuals that you work with.
That's all the questions that we have right now. If you have any others, go ahead and ask them now. Otherwise, I want to thank you for joining us and thank our speakers for sharing this information. And please remember to complete the evaluation that you'll be receiving via email once this ends. And then again, the presentation has been recorded and the slides will be made available hopefully before the end of the week.
There's one last question that has come in for Brianna. What is the fax number for Call It Quits?
It's on the referral form. So you'll actually need to have the referral form. There's a specific one that we use. So it's on the referral form. It's an 800 number. But you can connect with me, and I can either get you the form if you are currently enrolled, or if you need to enroll, I can help with that as well. But it is something that you would need to be a part of the program for. We do assign a 4-digit specific ID, so that's how we are able to track. So we would need to use that specific form and ID, and that would include the fax number.
Okay, if there's no more questions, then we will conclude. Thank you so much.